Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up, hard to believe, but it's time for flu shots again. 40 million doses have been shipped as the CDC tries to get ahead of the bug. Here's John with more.
The calendar still says summer, but 89-year-old Angelina Stamis is already thinking about the flu.
Wipes you out. You become a worn-out dish rag.
She came to this clinic in Arlington, Massachusetts for people 65 and older. Those vaccinated here received a special high-dose vaccine 4 times stronger than the regular one. This could help older people mount a better immune response.
And I think everybody should get it. I really do.
The CDC recommends flu vaccination for everyone 6 months and older. Last year, the vaccination rate was only 47%. New research suggests vaccinating younger adults in a community helps reduce the rate of flu in the elderly. Dr. Kathleen Newsel is a vaccine researcher.
For young and middle-aged healthy adults, protecting others should be as compelling a reason to get the influenza vaccine as protecting yourselves.
Last year, the vaccine was only 23% effective because the predominant strain mutated after the vaccine had already been manufactured. Officials say this year's flu vaccine is well matched right now to circulating viruses.
John, so how effective is the flu shot in the typical season?
In a typical season, it's about 50 to 60% effective at preventing the flu. So that's actually less effective than most of our other vaccines. But you have to think about this. Even if you do get the flu after getting immunized, the case that you get is likely to be less severe. So it could still be important.
Well, next up this morning, aspirin's double dose of potentially life-saving help. For the first time, aspirin is being recommended to prevent cardiovascular disease and a form of cancer. The U.S. Preventative Services Task Force believes the benefits for daily aspirin use outweigh the risk for some patients. Is this big news?
It is, and you know, it's really sort of helping us to navigate through this mire of really confusing information that's been out there. So for years we've known about the cardiovascular benefits of aspirin in people who've already had a heart attack or stroke. We know it can lower their risk of having another one. The big question was, what about everyone else? If you haven't had a heart attack or stroke, should you take a daily aspirin? So different medical groups were sort of weighing in with different recommendations, and frankly, everyone was confused, even within the medical community and the patients themselves. So the task force decided to put out some very clear guidelines about who would most benefit from daily aspirin therapy, both for cardiovascular disease, and this time they broadened it out to include colon cancer prevention. So those groups are adults who are between the ages of 50 and 59 years old, who are thought to have a 10% or more risk of having a heart attack or heart disease in the next 10 years, who don't have bleeding problems, and who have at least a 10-year life expectancy. That's the group who would benefit most, according to this task force, by taking aspirin every day.
But you have to self-identify that 10% though, right? So how do you know if you're in it?
Well, your doctor can do that. There are these online tools that are available. The American College of Cardiology, the American Heart Association have these tools. Other people have tools where you plug in risk factors. Right. Your age, are you a smoker, what's your blood pressure, what's your cholesterol level, things like that, and then it'll calculate that risk for you. The problem is there's no similar tool for the risk of bleeding, which is on the other side of that. You're trying to say risk versus benefit.
Well, so Holly, how do doctors calculate this risk then?
Right. I mean, well, John just really brought up the important point. Obviously, we know there are great benefits to daily aspirin therapy, but there are also significant risks. Aspirin changes the way our blood clots. It can increase the risk of bleeding in your brain or in your GI tract, your stomach and your intestine. So there's absolutely, despite these new guidelines, no one-size-fits-all for who should be taking aspirin. You really have to work with your doctor, look at your risk of bleeding, and balance that against your risk of having a heart attack or stroke or colon cancer.
John, when you look at the numbers, nearly 40% of Americans over age 50 take an aspirin, and they say it's for their heart. So if you have one of these internal symptoms that we've been talking about, how do you even know you have them?
We very seldom talk about this. We say, well, here are the complications, but how does the person know if they're having them? So aspirin can cause ulceration, you know, in your stomach or your duodenum, the first part of the small intestine, but really anywhere in the intestinal tract. So you may have symptoms like burning, discomfort, nausea, things like that, that suggest that you're getting an ulcer. But you may not have that. The first symptom may be something like bleeding. How do you know that you're bleeding? If it's very rapid, you could see red from below. But More typically, when you have bleeding from the upper intestinal tract, you get dark or black and tarry stools, and it may be increasingly foul smelling. So to be specific about that, I know it's sort of like nitty-gritty kind of details, but these are the kind of clues that people should be looking out for. And then, of course, if you have bleeding in the head, change in mental status, stroke symptoms, weakness, things like that. Bottom line is, if you are taking aspirin, you have any kind of new symptoms, just, you know, even the hairs on the back of your neck are standing up, I just don't feel right, talk to your doctor about that.
Don't ignore it.
Well, a new study looks at the effectiveness of a common ingredient in antibacterial soap. So what is the ingredient?
Well, so the ingredient is called triclosan, and one of the things is when you go into the store now, the store shelves are lined with things that say antibacterial, antibacterial. Right. So researchers here really wanted to focus on soap. They wanted to compare a soap that had a chemical called triclosan, which is an antibacterial, with just regular soap, you know, the old-fashioned traditional kind, just to see which one was more effective. So what they did was they used both types of soap and exposed bacteria, 20 different types of bacteria to the soaps. So they did that with test tubes and with people washing their hands. What they found was after 20 seconds, there was no difference in how many bacteria were killed between the antibacterial soap and the regular soap. It actually took 9 hours. The bacteria had to be exposed to the antibacterial soap for 9 hours for it to show any benefit. But really the bottom line is, who washes their hands for 9 hours? You know, you wash your hands for 20 seconds, and so ultimately there's probably no
Anthony stops at 8 hours. Generally about 8.5 hours.
I get a little tired at 8.
Well, we should note that a proposed FDA rule calls for antibacterial soap makers to show their products are safe for long-term daily use and more effective than plain soap. The FDA plans to issue a final rule by September 15th of next year. Antibacterial soaps are still allowed on the market at this time.
Finally, you might be enjoying a cup of coffee this morning, but new research suggests you may want to skip it at night. According to a small preliminary study, caffeine consumed a few hours before bedtime seemed to disrupt the body's internal clock. The researchers said this could cause daylight sluggishness like jet lag. I'm not shocked by this, I have to say.
I felt the same way.
Decaf.
Yeah.
No, and it's also, it's not just the circadian rhythm. We know that caffeine jazzes you up, and depending upon how you metabolize it, the caffeine you have in the morning can be around 12 hours later, even longer. So, you know.
I find even sort of mid-afternoon sometimes.
2 p.m. cut off.
Yeah, it lingers.
Okay. That's the rule. Dr. Jon LaPook, Dr. Holly Phillips, thanks so much.